Okay, so this is a reading of a report on statnews.com. It's about COVID and all that stuff. The headline of it, maybe it's an article. Yeah, it's probably an article. That sounds like the proper noun. Yeah, so it's an article on COVID. It's by Elizabeth Cooney. Hope I say her name correctly. Looks like it's an old lady that she has a profile picture and it's like a cartoon character. So I don't know, but looks like Mallory from Archer actually. But yes, the headline is called 1 in 3 COVID-19 patients are diagnosed with a neuropsychiatric condition in the next 6 months. Large study finds. Uh, I'm not very understanding of that grammar. That's not how I was taught to English. Or they're, I don't know. Maybe, I don't know. Maybe context would help. But yes. Time to read. 6 months after being diagnosed with COVID-19, 1 in 3 patients also experience a psychiatric or neurological illness, mostly mood disorders, but also strokes or dementia. A large new study shows. About 1 in 8 of the patients, 12.8%, were diagnosed for the first time with such an illness. Most commonly, anxiety or depression, compared to control groups of people who had the flu or other non-COVID respiratory infections. First ever neuropsychiatric diagnoses were almost twice as high. The study, published Tuesday in the Lancet Psychiatry, used real-world health data on millions of people to gauge the incidence of 13 brain disorders. Anxiety, mood, and substance use disorders were most common. But the researchers also found worrying, if lower, rates of serious neurological complications, especially in patients who had been severely ill with COVID-19. In all COVID-19 patients, 0.6% developed a brain hemorrhage, 2.1% an ischemic stroke, I don't know that word, MedPro has failed me, and 0.7 dementia. And here's a quote, I don't know from who, hopefully it tells me. We need urgent research to better understand how and why does this occur in patients with COVID-19, and how they can be better treated, and how to prevent it. Oh, it's by Max Takit, it says. I don't know if I can say that name right, but you're Max Takit in this video, or whatever the fuck. Oop, I'll try not to swear if I can. There may be children listening. A clinical fellow in psychiatry at the University of Oxford and a study co-author said on a call with reporters on Tuesday. But we think that regardless of this explanation, health services need to be prepared for the increased demand that this data is showing. End quote. The size of this study leads confidence to its findings, which confirms what has been hinted in smaller studies, including earlier work from the Oxford group. The researchers analyzed electronic health records of 81 million U.S. patients, both insured and uninsured. God bless America. Finding 236,379 people who had been diagnosed with COVID-19 and comparing them to 3 cohorts of similar people. One cohort had the flu, another respiratory illness such as sinusitis and pneumonia. And one cohort included people who were hospitalized for unrelated conditions such as bone fractures or gallstones. The researchers hoped that comparing the COVID group to others would help isolate COVID-19 as a cause and tease out its effects on the brain. After accounting for patients' age, sex, ethnicity, and existing health conditions, patients overall had a 44% higher risk of neurological and mental health diagnoses after COVID-19 than after flu, and a 16% higher risk after COVID-19 than after other respiratory tract infections. There were 2 exceptions. The researchers did not see increased risk of Parkinson's disease, a movement disorder, or Guillain-Barré syndrome. Barré syndrome? It sounds French. I don't know that's a language. uh, which is a rare disorder that shows up after some viral infections as tingling and weaknesses. Yeah, tingling and weakness when the immune system attacks nerves. Alison Navis, assistant professor in the Division of Neuroinfectious Disease at the Econs Econ 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 School of Medicine at Mount Sinai, sounded a note of caution. The lead clinical neurologist at Mount Sinai's post-COVID clinic, she was not involved in the Lancet study. Beginning of quote, it does highlight that there is something unique going on with COVID, end quote. She told start quote, and the 12.8% who have a new diagnosis of something neuropsychiatric can sound very sensational. That 12.8% encompasses depression and anxiety, so it's extremely important to not minimize that and not make that sound like a lesser diagnosis at all. But the more severe things like strokes are still fairly uncommon. I don't want people thinking that 1 in 10 people get a stroke with COVID, end quote. The new study reinforces previous research that showed some brain disorders increased with severity of illness, going up in people who needed to be hospitalized and rising further in people who needed intensive care. While 33.6% of people who developed a neuropsychiatric illness overall, that risk grew to 46.4% among COVID patients treated in an ICU. What's new in the distinction between neurological and psychiatric complications? People with very severe COVID-19 had a higher risk of complications like stroke or dementia, but people who developed anxiety or depression spanned the spectrum of illness severity. While the study did not examine the mechanisms that might explain neuropsychiatric disorders associated with the virus, the authors did speculate in the call with reporters that if patients know that they have COVID-19, that and other stressors might contribute to a psychiatric illness. Beginning quote, it could be psychological factors and biological factors and psychosocial factors, such as, for instance, the need to isolate and the loss of income as a result of that, end quote. Taquit said, that person from earlier. It's easier to tie neurological disorders to the virus's effects on the brain. Scientists believe the virus can enter the brain through the olfactory bulb, where the taste and smell are decoded. Inflammation throughout the body also harms blood vessels in the brain and can lead to stroke-causing blood clots, delirium, or dementia. While the medical records could tell the researchers whether someone had previously suffered a stroke or been diagnosed with dementia, they couldn't surmise whether someone was going to have a reoccurrence anyway or whether COVID-19 caused it. Masood Hussain, I hope I say his name right, or she, I don't know. Don't know what name that could be too. Professor of neurology. Masood Hussain, professor of neurology and cognitive neuroscience at Oxford and a study co-author, warned longer follow-up will be needed to answer that question, but the signal was too strong to ignore, he said. Hussain also cautioned that the numbers they reported could be an underestimate if they don't include people who were infected with COVID but did not test positive for it, or if people had no symptoms, or if people had no symptoms that drove them to seek medical care. On the flip side, patients with COVID-19 might be more likely to have neurological and psychiatric disorders diagnosed simply because they were receiving more medical attention compared to patients with the flu or other respiratory infections, Taquit pointed out. This was not a study of long COVID, said Paul Harrison, professor of psychiatry at the University of Oxford and a study co-author. Referring to the constellation of lingering symptoms that overlap with some problems caused by the neuropsychiatric illness described in the current paper. But the need for more research and continued clinical care is the same. Beginning quote, sadly, many of the disorders identified in this study tend to be chronic or recurrent, so we can anticipate that the impact of COVID-19 could be with us for many years, end quote, Jonathan Rogers and Anthony David of University College London wrote in a commentary appearing with the Lancet study. And that would appear to be the end of the article here. It says some stuff here about the author. So you can contact the author of the article, Elizabeth Coney. She's the general assignment reporter of, I assume, statnews.com. It says that she focuses on cancer, biomedical engineering, and how patients feel the effects of COVID-19. She has an email here. It's elizabeth.cooney@statnews.com. And she has a Twitter @Coney_Liz. I'll link those. I'll link this into the video, the website where the article is, and you can if you are that interested in the author, you can find it within that link. I'm not gonna bother linking her. I don't see the need to. Yeah, it's got tagged with. Yeah, I won't go on it, but yeah, that would be the thing. Yeah, there's comment. Okay, I'm not gonna read that. So there are like some links within this article too, like there's the actual study of the 6-month-long neurological and psychiatric outcomes of the 236,379 people. I might read that, but it's mostly a bunch of graphs. There's some words, big paragraphs in there too. It's pretty long, but you could, if you do go to the website, you can, go to the link in the description below. I'll link the actual study to it so you can look through it. And for any like normal person, they'll click on the link, they'll scroll through like, oh, that's a bunch of graphs and numbers. Okay, because who wants to read that? I mean, I might, but yeah. And there's a second study, second link in this article for like the previous study it referred to. Yeah, so that was in reference to the earlier work from the Oxford group, and that one's about bidirectional associations between COVID-19 and psychiatric disorder, retrospective cohort studies of 62,354 COVID-19 cases in the USA. Man, remember back when we had those small numbers? Anyways, so yeah, it's this one has numbers in it too, but it doesn't. Okay, it has a few graphs actually, but now it's okay. There's a study there too. I might read this too. I don't know. Yeah, but I did read the this article here about it, so hope you enjoyed that. And, have a lovely day.